Good afternoon and welcome to our Newsmaker virtual event hosted by the Milwaukee Press Club, WizPolitics.com, and Rotary. I'm the Milwaukee Press Club's president, Gene Miller. This is our second such event, so we've got one under our belt, and we are so grateful to County Executive David Crowley for joining us for number 2, as well as our panel. First, some thank yous would be in order. Milwaukee Press Club's Newsmaker Luncheon Series is underwritten by presenting sponsor Spectrum News 1 and our sustaining sponsor, Mueller LLC. WizPolitics partnering as well for this Milwaukee Series event, sponsored by UW Milwaukee, Wisconsin Academy of Global Education and Training, 1125 at Pabst, Milwaukee Police Association, the Firm Consulting, Medical College of Wisconsin, and Spectrum. And like I said, the Rotary Club of Milwaukee is also partnering in this. And we really want to thank Rotary and WizPolitics for getting us up to speed on this new technology. Again, we usually do these events at the Newsroom Pub in downtown Milwaukee. We certainly miss the camaraderie. We miss seeing you all. I personally miss the tortilla soup, but whatever the case, you got to go with what you have. And this is our new normal for now. So with that, let us begin. Basically, what we're going to do today is have our panel of journalists ask questions of the county exec after he gives his opening remarks. And then after that, you're welcome, or during the course of our chat today, to send your questions along if you're watching along at home or in your office. And we'll go through that list and try to squeeze in as many of those as we can at the end. Our journalist panel today, Courtney Garish from Spectrum News 1, also Aaron Mabin from Fox 6 News, and Mary Spacuzza of the Milwaukee Journal-Sentinel. That will be our batting order for today. Our guest today, of course, newly elected Milwaukee County Executive David Crowley, elected April 7th as part of that election that we all remember so well for so many reasons. And new to the job, but certainly no stranger to politics in the state or locally. So without further ado, let us begin our Newsmaker Luncheon without the lunch, but we do have Milwaukee County Executive David Crowley joining us on this Newsmaker Luncheon. Thank you, County Exec, and the floor is yours.
Thank you so much, Gene. I want to say thank you to Gene, thank you to our panelists, thank you to all the journalists and members of the public, not only listening, but watching today. It's an honor to be here as the new county executive. And I'd like to take this opportunity to really introduce myself, share what I care most about, and talk about what I will achieve as far as the vision for a healthier and more equitable Milwaukee County. But I first want to let folks know that I am a family man, so I want to make sure I take time to talk about my wife and 3 daughters. And basically, they have definitely understood the fact that they are ready for me to get out the house to do a lot of this work. Transitioning has been definitely interesting, but when you're doing all these Zoom calls and interviews at home with a 12-year-old, a 3-year-old, and a 6-month-old, things can get a little hectic at home. So I just want to say thank you to my wife. I love her to the moon and back and really appreciate her. But I guess I want to see this community thrive for them and for their future, to be quite frank with you. I do not take lightly the fact that I'm entering office in unprecedented times and in the middle of a pandemic. For those of you who do know me, I am a real people person. So, this social distancing is really hard for me. And so I actually prefer to call it physical distancing because I think it's extremely important that we stay connected socially. And many people need that. Even as we take safety measures to protect ourselves from COVID-19, I want folks to understand and you all to know that I will be out and about. I think that as elected official, as the incoming county executive, I don't get a pass on necessarily connecting with the community because of this pandemic. And so I will be wearing a mask. I will stay at least 6 feet away from folks, but I need to hear from this community. And in all seriousness, I care about making a difference in the lives of people here in Milwaukee County. And I think that folks really understand that when we talked about this race, it was about bringing more people together. I care about our neighborhoods thriving. I care about whether everyone has the opportunity to be safe and healthy, and not just during the COVID-19 times, but all the time. I care that we have enough funding to provide the services you folks rely on an everyday basis. And I do not take lightly that I am the first African-American elected to this seat. And with the chairwoman, Marcelia Nicholson, coming on board, I think we're at a pivotal point here in Milwaukee County's leadership, but also the city of Milwaukee when you think about Chevy Johnson, Cavalier Johnson, who's also president of the city council. And so I'm looking forward to working with the leadership here in Milwaukee County because we need innovation and we need bridge building. And this is building bridges with Madison, the rural parts of the state, even Milwaukee County, throughout the county, to make sure that we're doing everything that we can to locally coordinate around the response to COVID-19. I've been encouraged of how all 11 health departments in Milwaukee County have worked together to address the pandemic. I've also been encouraged by the amazing staff at Milwaukee County who are truly on the front lines. And yesterday I had the opportunity to visit BHD, the Behavioral Health Division, and really show our nurses their appreciation for what we're doing. It was the end of National Nurses Week, but this is also Mental Health Awareness Month. And so we need to make sure that folks understand that we have to show up every day to care for the adults and children in crisis, and I really appreciate them. But not just our nurses, also our bus drivers, our housing outreach workers, our 911 operators, our senior care providers, even our medical examiner who are out there every day making sure that things are working. And they can't work from home. And so our cities and villages who have been alongside us, but it is Milwaukee County that's providing that critical direct human services and emergency management efforts that are responding to this pandemic. The demand for county services is definitely skyrocketing. Our ability to pay for them is plummeting. And so the fiscal impact of the coronavirus on Milwaukee County will be catastrophic. We already have a $40 million in costs directly associated with COVID-19, such as PPE for employees, that's overtime and telework, enhanced cleaning and sanitation, and temporary homeless shelter, and even a temporary morgue. But by the end of 2020, we will have a loss of close to $100 million in revenues, and that's revenues from sales tax, property tax, program revenues, whether we're talking about the zoo, parks, airport, and transit. To stop the bleeding, we have been making some progress. We've already made about $60 million in cost savings and in cuts. We have implemented a contract and hiring freeze, spent down all of our land sale revenue, and reduced or eliminated critical capital projects while continuing to provide critical services to folks. We are depleting our rainy day contingency fund. We have furloughed more than 700 employees, which is about a fifth of the workforce. So if you remove public safety, if you remove emergency management services or our operation for emergency management, that's almost half of Milwaukee County employees. And to be frank with you, this is extremely unsustainable. It will directly impact our ability to meet the challenges caused by this crisis. The next cuts we will have to make will damage our response and recovery efforts. And the pandemic has only exacerbated the longstanding fiscal crisis the Milwaukee County has been facing for decades. I'm willing to make tough decisions to close our budget gap, but we are chipping away at the bone. This is why we have to call on the state to make direct and flexible funding available to Milwaukee County, but also every county. I mean, all 72 counties have been on the front line, so I think every county needs to make sure that they get the direct and flexible funding. And I mean, this ask includes restoring about $103 million that has been the redirected balance of Milwaukee County's coronavirus relief funds. We're also asking for direct and flexible funding for all county governments in Wisconsin to aid in this response. We're working with partners all across the state to get this done for the people of Milwaukee County. And that leads me to ask you, actually, a call to action. As the press, you play a powerful role in holding elected officials accountable, including myself. So, continue to cover the fiscal impacts of COVID-19 on local governments and our state. Help us show the need for essential services. Continue to amplify the public health message over politics. As a leader, I will also continue to do this. And I think that's extremely important, that we look at the data and the science behind this. And please continue to report on disparities faced by Black and Brown people in this community. Only when we lift up the experiences of people of color, we will start to address the root causes of the inequities. And I say that because I know one of the things that we're going to be continuously focusing on is the how do we open up. And there has been recommendations even about wearing masks. And so we have to make sure that we are checking our biases and we understand the historical context of biases here in America, and making sure that when people of color are wearing masks, that it is normal, and that we aren't necessarily throwing our biases out there. And so we want to make sure that people are protecting themselves. And as Milwaukee County Executive, I would do everything I can to ensure that when Milwaukee County does bounce back from this crisis, none of our residents are left behind, no matter what zip code they live in. And so I just want to say thank you for this opportunity, and let's go to the panel.
Right. Good afternoon, everyone, and thanks for joining us. I wanted to start with this Supreme Court decision that we're all waiting on regarding the challenge to the Safer at Home extension. If the court does rule that the state order is lifted, the state reopens, but counties have that flexibility to guide their own reopening. You just talked about the economic impact on the county. What would Milwaukee's county's plan be in that scenario?
It's a good question. So when we, first and foremost, Milwaukee County itself does not have a health department. We have 11 different health departments across Milwaukee County, 19 different municipalities. So it's going to be interesting to see what the Supreme Court does. What we're trying to do is find as much alignment as possible with the public health officials, with the business community, as well as the medical providers to make sure that there's some alignment so we can, again, focus on the how do we open up versus the when do we open up. I'm a strong supporter of making sure that we have a healthy economy. A healthy community, because that's the only way that we have a healthy economy. So I know businesses are itching to open up and people are ready to get out of their homes. But if businesses are going to open up, we need to make sure that their workforce is safe and that we can also protect their customers that are walking into their doors. And so, right now it's about finding alignment so we can get the how together, so we can be prepared for when that ruling does come.
Okay, Aaron, over to you.
County Executive Crowley, thank you so much for joining us today. We really appreciate your transparency. I want to go back to the topic of furloughs and cuts that have already happened within Milwaukee County. Can you go a little bit more on when those started and specifically what department, what sectors of the county were cut? And I guess what that next step would be, where else would those cuts come from? Or furlough?
So where those cuts come from, we're really not in a position to say right now. We have to continue to do a deep dive. We're currently in that process right now. But many of the cuts and furloughs began to happen right before I came on board, but I was preview to what was happening right after the election. I really hit the ground running to figure out what was happening within Milwaukee County. And so we make sure to take an equitable approach. So we've seen furloughs all across different departments. We haven't necessarily furloughed too many folks from our emergency management, public safety, and public health, because they're at the forefront of this pandemic. But we are looking to department heads to see what else that we can do to be innovative and creative to make sure that we can look at any possible savings that we can to stay ahead of this, but also to make sure that we are preparing for the next budget cycle in 2021.
Thank you, Mary.
Hi, thanks so much for doing this panel with us today. Before this outbreak, we talked a lot about juvenile justice and juvenile justice in Milwaukee County and statewide. Do you have any updates that you can give us in terms of whether children in the Juvenile Justice Center are still learning amid the pandemic? Any updates about whether they can have visitors at this time, or if that's too great of a concern due to the coronavirus outbreak? And also if you have any updates on the situation involving Lincoln Hills and Copper Lake. So I know that's a broad topic, but just juvenile justice.
We're continuing. So to start with Copper Lake and Lincoln Hills, we're continuously, working with the governor. We're asking the governor. I had a conversation with the governor about the COVID-19 crisis, what is happening related to Lincoln Hills and Copper Lake. And so right now, it's really about how we're going to make sure that we can come up with our end of the dollar amount to make sure that we continue with the build out at Bell Phillips. I am happy to say that, if I'm not mistaken, we have not had any type of outbreak at our juvenile facilities. And so I had a chance to actually go visit and see a lot of the things that they were doing within my first week of actually being sworn in, and really proud of the fact that they're taking extra precaution with the young people, as well as with the staff there, to make sure that they're not spreading the virus within those facilities. I did have a conversation with the principal down there. No, school has not been going on because they want to make sure that people are continuously protected, because school isn't happening anywhere here in the state of Wisconsin. So no learning is not happening right now, but that's because we're taking the best safety precautions we can to make sure that none of these young people are contracting this virus. But we need to make sure that we're continuously protecting them. And so, we're going to provide everything that we can, continuously working with the Wauwatosa Public Schools to see that, what happens, again, what's going to happen with the Supreme Court order. will help us understand what we'll be able to do moving forward.
Thank you.
I wanted to talk about, you mentioned this, the county services and how important they've always been in Milwaukee County. And even now during COVID and then after COVID, as we start to, segue back to normal, how do you do that? You continue service and maybe even add services when you are facing all of this revenue loss and cutting in departments. What's the plan moving forward for that to get families the help they need?
Absolutely. So we have been in constant communications with the federal delegation, state legislature, as well as the governor's administration. So we're looking for about $62 million to come directly from the federal government to help us with related costs to the COVID-19 crisis. So that's related to PPE, that's related to many of the services that we're providing or had to redirect as a response. But there's also some dollars that the state of Wisconsin has also received. And so not only is Milwaukee County, but every, I think, local municipality has been talking with the governor's office about funding, direct and flexible funding. And so we've asked again for about $100 million. And if we can get that, that would help us out tremendously moving into the next budget, thinking about all the costs that have been redirected specifically towards the COVID-19. But we have to think innovative and we have to be creative. And so, even before this, I talked about creating a office on special projects and grants to make sure that we're going after every dollar possible, leveraging every resource possible from state, federal government, as well as from the philanthropic community. So that's something that we're going to continue to look at. But we know that, we're going to have to work with the county board to make some tough decisions to make sure that Milwaukee County can continue to provide these critical services that folks will need in the future.
Okay, thank you. Aaron?
Early on, people would call the coronavirus and this pandemic the great equalizer. And I think over time we realized that necessarily wasn't the case, that this virus really affected communities of color, at-risk communities of color, much more. And I want to specifically focus in on African-American businesses in Milwaukee, especially at like the Sherman Phoenix area, where there are these African-American business owners. They're just starting, and then this pandemic hits. Is there a plan in place to really help revamp those businesses specifically within Milwaukee County?
Yes. So as we continue to lobby for direct services for Milwaukee County, we have to continue to lobby for those minority-owned businesses as well. And when you think about even like when the Paycheck Protection Program was rolled out, there are many small businesses, minority, women-owned, disabled, veteran-owned businesses who don't have those relationships with bankers necessarily to go after those dollars. And we know many of them have not been able to access it. So we are continuously fighting for that, talking with federal delegation, talking with the Treasury Department about what dollars, what resources they're going to bring back to Milwaukee County. But again, this is going to be about some tough decisions that we have to make. Even though Milwaukee County is receiving dollars, we know that the city may receive some as well. And so how are we going to work together in conjunction with one another, as well as the state government, in making sure that we're directing these dollars to where they're critically needed? And so we have to continue to fight for these businesses. I've heard from many of them personally, and done my best to connect them with somebody who can help them get many of these resources. But to be honest with you, many of them have been on the losing end, and we have to make sure that as we continue to talk about the resources local governments need, that we're fighting like hell for many of our small businesses that are the backbone of Milwaukee County, to be quite frank.
When we first started reporting on the disparities, the racial and ethnic disparities that were emerging in the pandemic, I noticed that Milwaukee seemed to be one of the first, if not the first, that was releasing that type of demographic data. And it really seemed to help shape the national conversation about who was being harmed the most by this. Was that a conscious decision that Milwaukee made because it's declared racism a public health crisis, or could you talk us through that decision to release that type of racial and ethnic data?
That was definitely a conscious decision. I just have to say thank you again to the former county executive Chris Abele, as well as the county board, for declaring racism as a public health crisis. The Friday before I was even sworn in, Chris signed his last ordinance, which really made sure to continue to focus on how we're looking through a racial equity lens in Milwaukee County. And I think that Milwaukee County is really taking a leadership role in making sure that racial equity is at the center of this. Many folks will sit there and say that, well, COVID-19, we see the disparities, this is clearly an issue. But what it really has done is exacerbated many of the health disparities that we see here in Milwaukee County. The disparities largely lay across racial lines, and I think Milwaukee County definitely understands that. And so if we're going to focus on getting Milwaukee County to being the healthiest county, but also making sure that we make decisions with a racial equity lens, it's extremely important that we don't forget about that in the pandemic. And I think that's easily to do, is to forget about equity in the midst of this. And I think that as long as we continue to do that, as long as we continue to focus on racial equity being at the core of many of the decisions, health decisions that we're going to be making, and making sure that we are on the road to being a healthy community, that's how we're going to lift this whole community up, is making sure that those who are at the bottom, those who have been, when I think about these disparities, I mean, it's sickening, especially as an African-American man coming into, this executive role, being the first, and even fighting for this at the state level. I'm happy that I'm in this seat to be able to carry, this mission forward on racial equity, because it's something near and dear to me, and I think it's something that we have to focus on in order to really push the envelope here in Milwaukee County, to improve our health disparities, to improve our education, and to improve our economic inequality that we see.
I want to stay on this topic. What are your takeaways now that COVID-19 has highlighted this issue? Are you seeing gaps that you didn't know existed, different ways to change the dynamic moving forward? I guess in a way, how has it helped so that you can formulate a plan as we get back to normal?
Well, I think, the first and foremost, the first glaring thing I think everybody's seen was, the fact that we have 11 different health departments, 19 different municipalities. So it's hard for us to really move forward. And so having one message, one Milwaukee County message has been quite challenging. And I think that's one of the things that we've seen the gaps in. But when you think about that messaging as well, the city of Milwaukee, Milwaukee County, we've been doing everything that we can, and the state of Wisconsin has been doing everything that we can to reach out to the public about, what the guidelines should be when going out in public. And I don't think that we've actually reached many communities of color or been intentional on making sure that we reach those communities. And so the other thing is that many of them are essential workers. And so what are we doing in making sure that we're getting them the proper testing? And I think that's a good thing with the National Guard now being here, because now we can give those symptomatic folks some testing now. And so we're doing things, we're making steps. Is it perfect? No. I guess to kind of quote Dr. Fauci, we're making significant steps, but these are modest gains that we're seeing. And so I can't say that we're in the clear or anything like that, but we have to continue to make sure that we're being intentional in messaging directly to communities of color.
Okay, thank you, Aaron.
You already mentioned May being Mental Health Awareness Month. I want to know what you are doing. You're coming into this during an unprecedented time. What are you doing to practice mental health? And what's the conversation with your family, your 3 young girls right now also?
Well, I can tell you, I am so sick of looking at screens. Again, like I'm a social person. So, I'm the type of person, if you see me, I want to hug, I want to shake your hand. I want to be interactive. And so, for me, what is helping is time with my family. It's being able to go in my backyard, barbecue for my little girls, but we're also into board games a lot. And so that gives us not only time to have fun, but a time to have some intimate conversations about what's going on, particularly in my 12-year-old's life. But my 2-year-old and 6-month-old, I think they're just going to enjoy this no matter what. But, my wife and I have had some, I make sure to give her space, because I'm doing this all the time, right? And coming into this transitioning during a pandemic can be very, very challenging, especially when you don't get a chance to even interact with the people who work with you at a physical level. But mentally is making sure that I'm actually talking with my mother, talking with my father, for me, I'm more worried about those who aren't getting the interaction that they need on an everyday basis. And I think that we need to make sure that our community understands that again, I hate the term social distancing, but it's really about physically distancing ourselves so people can still have that conversation, still feel like that we are still neighbors and that we still love one another. Because this is a time right now where we heavily need to lean on one another in order to get through this pandemic.
Domestic violence has also come up. It was, a problem with increasing deaths before the pandemic. We've seen some really tragic cases since then. Can you talk at all about your plans for addressing the problem during the pandemic and going forward?
Absolutely. Safer at home isn't necessarily safer at home for everybody. And I definitely recognize that, especially when I think about my own upbringing, growing up here in the city of Milwaukee within a struggling family. There's no way I would have been able to stay at home. And so that's one of the reasons why we're telling people that, one, you should go out, enjoy the parks, enjoy any recreational activity or any amenity that you can enjoy that Milwaukee County or anybody provides at this time, so you can get that self-relief, that relief that you absolutely need. But also making sure that folks understand that they can call 211. So as we continue to talk about people getting tested, 211 is a great tool for people not only to get tested, but to make sure that they have access to all the resources that they need in any situation that they may be in. And so there may be many individuals who are not only having mental health crises, but financial crises and need somebody to lean on. And so we want to continue to encourage folks to utilize those kind of services that they need, whether we're talking about housing, child support, because we want to make sure that people are paying their child support. We want to make sure that people are receiving the services that many of our seniors need, so making sure that those senior meals are going out. But we need to, this is really, when we continue to have this conversation, this is really about how we're going to do this together.
You just came through an election that the mayor called a fiasco in April. What do you feel you can do or the county can do when you look at November? And a couple subset questions to that. Do you think that we should be starting to plan to have it be by mail voting in November? And what would the cutoff be to make that decision so we don't see the whole absentee ballots not getting to people and having the time to get them turned in?
Well, I think that the state legislature needs to take this up as soon as possible. And we're going to continue to lobby the state legislature on that because they're the only ones that can make that decision. I think that we do need to talk about how we make sure that everybody gets an absentee ballot, but I also think that we also need to make sure that we have physical locations because not everybody has a place to mail an absentee ballot to. And so we have to make sure that we're thinking about everybody who either has a mailing address and don't, and making sure that they have access. But at the end of the day, we need to make sure that this is a safe process. I don't wish on anybody what I had to go through during that election, especially having to wait 6 days to know who the winner is. If you want to, I think I was more stressed out those 6 days than I were throughout this whole COVID-19 response. But they need to act. They need to act fast. We don't know how long this is going to last, and we can't continue to act like we have a crystal ball and can tell what's happening in the future. So the legislature needs to definitely make sure that every clerk across Wisconsin has the resources to be as innovative and creative as possible to make sure that everybody can cast their ballot. And so, we're going to continue to work with our municipal clerk, work with all the municipal clerks throughout Milwaukee County, and for what do they need? And what do we need to ask the state for as far as resources? But I think that the Speaker Voss needs to come in and absolutely, have a conversation about what this next election looks like.
Okay, Aaron.
I know you've connected with nurses at BHD. Just curious if you've talked to other nurses at other hospitals, other healthcare providers, other hospital systems about how they felt the county has responded to COVID-19. Are they still seeing PPE shortages, and how drastic is that? And I guess just give us an insight on what you're hearing from the healthcare system right now.
Absolutely. So, every day at 3:30 we have our daily briefing, and I think that we are on a good path. We have been working in tandem together to figure out what we need. I think right now The hospitals have about a 7-day supply of PPE, and I think they believe that that is sufficient enough for them to be able to take on any surge. But I also think that we also need to make sure that we have sufficient PPE as Milwaukee County, just in case. So if we're going to see more people getting testing, we need to make sure that our medical providers have enough PPE to administer those tests. And so, yes, we're going to continue to provide PPE wherever we can. That is part of the COVID-19 dollars from that $62 million that we're going to spend dollars on, is making sure not only the medical providers and Milwaukee County employees have PPE, but also the community whenever they don't have the ability or access to have one themselves. But I think that we could always do better when it comes down to contact tracing. That is one key that, unfortunately, we don't have that within Milwaukee County. That's within 11 different health departments. But many of them have been partnering up, and we provided support as well as the state to make sure that we're doing as much contact tracing as possible. But from my conversations with many of those providers, they feel that they are in a good place, to see a surge if we were to see one, God forbid.
Thank you, Mary.
Do you have any updates in terms of infections at the House of Correction and any kind of justice updates for that?
So I know that a couple of weeks ago you had the National Guard go in. If I'm not mistaken, as of a couple of days ago, we have 0 cases. And we've done everything that we can to make sure that if we do have anyone who tests positive, they can go into a totally different area to make sure that they're not spreading this virus across all the facilities. And so when we look at the House of Correction, we've reduced a lot of our population, but because of the COVID-19 response, we've seen an increase in costs. Those are one of the areas where we've seen an increase in costs to make sure that we're doing everything that we can to mitigate it.
Thank you. And just to check, was that 0 cases in terms of both inmates and staff?
From my knowledge, yes.
Okay, thank you.
We've seen some new news this week regarding the DNC. Just, getting to the point where they would have the ability to change the format of the event. I know we keep asking this question, but how do you plan for something of this magnitude when you don't know what's going to happen? But also, I know that the community testing that's happening now, it's a huge boost in testing. You get a better idea of where the virus is in the community, and then you can do the contact tracing. And the mayor said that that's going to increase confidence to hold this in-person event in August. What other things need to be in place from a health perspective? And does the DNC have kind of a checklist that you're following? And a follow-up question would be, how do you recruit all the volunteers that are needed for something like this if it is in person, but you don't really know if it's happening? Or
yeah, a lot of unknowns there, right? So right now, what the DNC has done is they made this decision to make sure that they have flexibility. So as of right now, we should be expecting the DNC to be here in August. So I want to make sure that everybody understands that we are operating as if they will be here. I think they just want to make sure that as things change day to day with the COVID-19 response, that they can be able to change whenever they need to. So we need that flexibility. And so, a lot of our staff, our our operations of emergency management would be dealing with a lot of the safety aspects with the DNC. And so some of our staff is still working on that, but majority of our staff is working on the COVID response right now. And so at the end of the day, I can't think about what the DNC needs until I have a healthy community. And I think that's what's going to be critically important, even for it to even be hosted here in Milwaukee. And so again, we have to have a healthy community before we have a healthy economy. So my goal is making sure that, this is a healthy community. And then if the DNC is going to be here, as it should be as of today, let it happen. And I'm really excited for it to happen. A lot of people always ask, well, what is the economic impact of the DNC not coming? We've never had a DNC coming to Milwaukee, so I think we understand that, we can't count money that we've never seen. But right now, I think that we're in a good place in making sure that we can do everything that we can to make sure that Milwaukee residents are safe. And again, it's not just about Milwaukee. In the state of Wisconsin, we have 49 other states to make sure that they have safe protocols in place to make sure that the folks who are going to attend the DNC convention can attend the DNC convention. And I think a lot of times we just expect that there's just going to be, 50,000 people coming. And even if it is a scaled down version, whatever that may looks like, if need be, even if it's just those delegates, I think it's something that Milwaukee County would be able to have.
So a quick follow-up question. The county is still entering into contracts as they plan for August?
So Milwaukee County has not entered into any contracts. We've frozen all contracts because of this COVID-19 response, but it's not to say that we aren't doing our due diligence just to be prepared.
All right, thanks. Aaron?
We saw on Monday those 2 testing sites open, one at Midtown, one at UMOS. Do you have the number of people who came through on Monday, Tuesday, and maybe this morning? And is it enough of a demand to add more National Guard sites in Milwaukee?
Absolutely. So really good question. If I'm not mistaken, maybe about 1,800 people may have utilized those sites on Monday. I don't have, if I'm not mistaken, I don't have any updated numbers for Tuesday or even for today. But that's a decision for the National Guard to make. And to be honest with you, I hope that they would want to expand those sites because this is going to be about testing. A lot of us are focused on those positive cases, but we need to see a ratio of making sure that increasing the amount of testing and seeing who are the positives so we can get a better understanding of what is happening in this community. I'm not a doctor, so I can't really, talk too much about it, but I think that in my personal opinion, I would say that I definitely think that we should expand those sites.
Just to go back really quick to those contracts that you mentioned that you've frozen, have you been canceling contracts related to the DNC or just freezing any? Had you already entered into some, or are you just freezing any contracts at all, or just specifically DNC contracts?
So I don't know the answer to that particular question. I can get that to you, but I can tell you that, and I don't necessarily know if these are DNC, any contract that we may have entered into, I think we're probably fulfilling that, but we have not entered into any new contracts.
Okay.
Let's talk summer and Milwaukee County pools. I mean, I guess fingers are crossed because kids and it's, you want to enjoy summer, but what's the reality of that? And when would a decision like that come down?
So the decision of that is based off of the science and the data. And so, we are, I'm leaning heavily on our public health officials, what our medical providers are saying before we decide to make those types of decisions. But I also think that it's extremely important that, again, as Milwaukee County, we have one message, that we're all on the same page. And so I think that we have to make sure that the communication is being shared amongst all the municipal leaders, business leaders as well, and the public health officials before making those types of decisions. So I think that we have to continue to look at the science and the data on that.
Okay, Aaron?
I want to talk about, we know Chris Abele was such a supporter of yours in the beginning, early on, still to this day, likely. How often are you all talking? Are you happy with the transition? And I guess, what are you leaning on him for right now when it comes to knowledge and everything that you're going through? Can you walk us through that?
Absolutely. So they were extremely helpful with the transition. I don't think that you would ever see this amount of collaboration in any local transition, to be quite frank with you. So I have to say thank you to Chris Abele and his staff. And many of them I've actually asked to stay on because they have been at the forefront of this COVID-19 pandemic. And so many of them have been extremely helpful in keeping me briefed on, the history, what has happened since I've been in office, but even before. And so they've been very helpful. And Chris continues to be extremely helpful as far as advocating for the resources that Milwaukee County needs. And so I know that he has done his due diligence in making sure that he can reach out to the governor's office requesting those resources as well. But, I think that right now, I haven't talked to him since my swearing in because I think he's enjoying not being elected.
Thank you. We've talked so much about coronavirus, and I don't want to skip talking about your priorities and other things that you want to take on as county executive. So is there anything that we haven't asked you about in terms of what you want to tackle first now that you're our official county executive?
Well, you know, a lot of the things that I talked about in the campaign trail, we need more now than ever. So we talked about, you know, building a bigger, diverse table, whether Republican, Democrat, union member, or business owner. We need all of those entities to come together to figure out how we get through this pandemic. So that's going to continuously be a priority of mine. I also think that we need to continue to identify resources out there, especially now when we see the revenue loss that we're projecting. And so creating a special projects office and grant office is something that I think will help sustain Milwaukee County in the future, with helping us leverage other resources that are out there, but also continuing the work around homelessness and racial equity. We've been working on a strategic plan about how we can continue to move Milwaukee County in the right direction, so we can continue to provide those quality services while also cutting costs wherever we can while we go through this pandemic and get ready for the recovery. But this is something that Milwaukee County needed in general when you think about the financial situation that we're in. And so we're going to continue to lobby the state and build partnerships across the state to make sure that local municipalities are getting the revenue that they desperately need, and not just because of the COVID-19 response, but we needed it before now. And so COVID-19 has really exacerbated everything that we have been talking about for decades here in Milwaukee County, and we need to utilize this opportunity to take advantage of it right now during these challenging times.
This is kind of along the lines of Mary's question, but do you see one biggest hardship coming out of Safer at Home as we start to reopen the state for Milwaukee County, and what will your first focus be?
Well, I guess the biggest hardship is really getting that one message, that one Milwaukee County message out there, getting 19 different, municipal leaders, village board presidents, and mayors to say that this is how we're going to operate. And I say that because, even though we're talking about a Milwaukee County approach, we're going to have to focus on how we also do that regionally. How do we work with Waukesha, Ozaukee, Washington, Racine, Kenosha? We have people who come from Waukesha, Ozaukee, and Washington to Milwaukee County for work, and vice versa. And so I think that the biggest lift in all of this is, what does this look like? What regional approach, what regional alignment can we find to make sure that we're not placing a huge burden on businesses and our community members?
Aaron?
Thank you. You announced cabinet picks a little bit earlier this week. What went into those decisions, and when can we expect to see more cabinet picks announced?
So I'll tell you that as far as more cabinet picks, this is taking my time with this transition. Nobody has a blueprint on how to, walk into a county executive's office in the middle of a pandemic. So we're taking our time, again, keeping many of the essential staff on for at least the first 60 days. But when I picked my chief of staff, when it came down to Mary Jo Myers, I know that, health disparities is something that I want to continue to focus on, as well as racial equity. And I think they go hand in hand. And with the work that she has been doing, not just only as a department head at DHHS, but throughout her career in health and human needs and health and human services, I think this will be an excellent pick in helping me fulfill my vision and us getting to being the healthiest county and making sure that we keep racial equity at the helm of that. And then when you think about Julie Landry and Margot, Julie has worked in human resources for 20 plus years. And when I had a chance to sit down with her and, we just gelled, and to hear her vision and hear some of the things that she's been through, but also she had the opportunity to work closely with the departing DOS director to kind of get a lay of the land of how things operate. It was almost a no-brainer. And so that's one of the reasons why I brought her on board as the DOS director, moved her from the HR head to DOS. And then you have Margot, who's been with Milwaukee County for about a year. And when it came down to actually picking Margot, I actually went and talked to other county employees. And so it wasn't just like, I'm just picking her to be picking her. We really went out and talked to, county employees, got their feedback on many of these individuals before making a decision. because I need to make sure that whoever I'm bringing on can work well within the organizational structure, understands that structure, but also can work well with the Milwaukee County Board so we can truly put Milwaukee County on its best foot forward.
Before I toss it over to Mary, how often are you home? How often are you actually in the office?
So I've been to my office twice, just twice. So I haven't been going in that much. But right now I'm spending a lot of time home, making sure that I am being an example of what physical distancing looks like. But I'm also making sure to make sure that we say thank you to all of our essential workers. So I have had the opportunity to go to the Behavioral Health Division. I have had the opportunity to go to the Bell Phillips Juvenile Center and the courthouse, and to thank those folks who are on the front lines. And we're going to continue to do that while continuously practicing, following the CDC guidelines of physical distance.
Thank you. Mary?
This came up a bit earlier, but if the state Supreme Court were to just strike down Governor Evers' stay-at-home order, how much power would you have as county executive to step in and close things or order things closed or not open things, given that the Governor Evers' order was already struck down?
So if I'm not mistaken, none, because Milwaukee County does not have a health department. So if the state statutes puts that power into those public health officials. And so we have 11 of them in 19 different municipalities. So some of those health departments are consolidated. And so that's why it's a goal of mine to make sure that as Milwaukee County, we're working in conjunction with all 11 of those public health officials. We've been talking with the Medical College of Wisconsin, as well as the MMAC. And so we were able to get many of them into a same place, in a sense, over the weekend, to where this past Monday, the ICC passed a resolution endorsing the public health officials to continue to allow to work in this coalition to figure out the how we open up. Because I think it's extremely important that we do not wait for the Supreme Court order to be prepared for.
You were talking, when you were talking about your staff and some of the key people, as far as the health disparities go, that are, really COVID has shown a light on and will continue to be there moving forward. I know there's been a lot of talk too about finding a medical home for people, because a lot of people don't have that for many different reasons. How difficult has it been to get that message out? And are you seeing more individuals find that home right now?
I'm not sure if we're seeing individuals necessarily finding that home necessarily. And I think a lot of people, if you look at all 17 testing sites that we have, they're not necessarily operating at a high capacity. So we need to make sure that we're doing everything that we can, especially those who are symptomatic, to call 211, get an appointment. So when they do get tested, they have that follow-up, and we can continue that care with them moving down the line. And that's really right now the only tool that we have to do that, because those who are going to the National Guard, if they are symptomatic and they are tested positive, then they're just going to their provider. But we have to make sure that, one, all the local municipalities and the public health officials are doing the contact tracing to make sure that we're doing our due diligence. But we have to provide that information out there, and that's why you will hear me consistently say, for folks who don't have a medical home, call 211. Call 211 and let's see what we can do for you, whether that's getting you on some state assistance, but we need to make sure that we're providing everybody with as many resources as possible to keep them safe.
Aaron?
I'm such a goal-oriented person. I was a little notepad and notes and everything. What goals do you have? And I guess what has really come to the top in the past few weeks?
I guess the biggest goal right now is to get to a place of normalcy for everybody here in Milwaukee County. And so, and the way you do that is bringing more people to the table to make sure that we have a how in place to make sure that we are on the road to recovery. And so, the goals change day by day when you're looking at the science and the data right now. But at the end of the day, is to make sure that, one, Milwaukee County can continue to provide the critical services that we're providing for folks during this pandemic and afterwards, because I can only imagine how many people will need our services once we are in recovery mode. But again, making sure that there's a level of consistency, a level of confidence that people can enjoy life again. And that's going to be extremely important, one, to get the DNC here, as everybody wants to see, but to make sure that, we can again, put our best foot forward in being able to compete globally. And I say compete globally because even though we are in challenging times, we also have to look at the many different opportunities that's presenting itself. And so, what can Milwaukee County do now in partnership with all our local municipalities and surrounding areas to make sure that once we are, I guess, at the end of recovery, that we're not just surviving, we're beginning to thrive.
I don't know if we have to jump to audience questions, but I had one quick one, which was, I know that some small business owners have warned that they may not be able to open again, that they've been temporarily closed, but it's been so hard for them that they just may shut down. I'm sure Milwaukee doesn't want to see vacant businesses or foreclosures. Could you talk specifically about what you're doing to help? I know you mentioned touch on this a bit, but help small businesses, help women, African-American, Latino-owned businesses throughout the county.
Absolutely. So we're still trying to figure that out. Last week, I can tell you that I had a good conversation with the president of WIBIC about what opportunities are out there, how we can utilize some of these COVID dollars to help out small businesses. But again, we're going to continue to lobby the federal and state government to see what they can do. There are resources out there. We're hearing rumblings about more dollars, another stimulus package coming down the pipeline. So we want to be at the forefront of that and making sure that we can help mold that to make sure that businesses are getting what they can get. But I think that we need to make sure that we're connecting them with the proper resources. So, call Milwaukee County, call the WEDC at the state, call the Small Business Administration to figure out what resources are out there, and we will help them connect to anybody that can get them connected to them.
We're going to end it right there with our panel. Great job, everybody. Everybody got the same number of questions. Went perfectly in terms of distribution. Great topics addressed. Just a couple of follow-ups. County Executive Crowley, one of our viewers wants to know, in what ways will your leadership style differ from that of your immediate predecessor?
Well, the biggest difference is I'm a person who likes to lean on others. And when I say lean on others, I like to make sure that I listen to different perspectives and bring more people to the table. And making sure that I understand their perspective. But the biggest thing is making sure that we are bringing the county board along with us to make sure that they don't feel like they're being left behind. And so I want to make sure that we can repair that relationship and making sure that Milwaukee County is doing its best to provide quality services that folks need right now.
And one more question, would like to know whether you have or will set up or establish a committee or group to determine how funding for specific county programs and services will change because of lost tax revenue while businesses are or were closed.
This is a conversation that we are actually having. Myself and the chairwoman briefly discussed this actually a couple of days ago, so it is in its infancy stages, but it is a conversation that we are currently having.
Very good. Thanks once again, County Executive Crowley, for being open and candid and willing to take on all comers today at this newsmaker situation, and hope we can keep this pipeline open through the course of your administration and your stay as county executive. Once again, we would like to thank our sponsors, Spectrum News 1, Miller Koss, and also Wiz Politics, who partners with us for their Milwaukee series, and their sponsors, UW Milwaukee, Wisconsin Academy of Global Education and Training, 1125 at Pabst, Milwaukee Police Association, the Firm Consulting, the Medical College of Wisconsin, and Spectrum. Also thanks as well to our partners at the Rotary Club of Milwaukee. We are going to do another newsmaker situation that will be happening next week, Friday, May 22nd, when new Milwaukee Common Council President Cavalier Johnson will be our guest again. That will happen starting at noon. That'll be a 1-hour affair, just like this. 3 panelists, viewers watching at home or at the office, and their questions, as always, will be welcome for that event. Thanks once again as we get used to our new normal. Welcome to my spacious Hales Corners Digs. And Mary, before we go, I think we got to ask, who's the beautiful woman that was looking over your shoulder this whole time? I think we got
that is my grandmother. Sorry, I was muted. That's my grandmother, Paula or Pauline Palmisano Spicuzza, and she was painted by Francesco Spicuzza, my great uncle.
Yeah, you win the prize for best background today. That was stunning. Thank you so much. And again, if you'd like to join us for our next Newsmaker on May 22nd with Cavalier Johnson, just go to our website, MilwaukeePressClub.org. And if you're watching right now, you're probably pretty familiar with that. You have to register ahead of time, so we'd like to have you signed up for that event as well. And stay tuned. We're going to be doing more of these as we continue to fulfill our mission, bringing newsmakers to reporters, to the media, and of course to you, our viewers, and to our Press Club members. So thank you so much for being patient with us as we learn our way these new ways, these new Zoom screens and everything else. Someday soon we'll be as social as I hope County Executive Crowley wants us to be once again. We're all looking forward to that day, but until then, this is how we're going to do our mission. Thanks again to everybody for taking part. Courtney, Aaron, Mary, and thanks as well to Joette Richards, who helps put this all together, and our friends again at withpolitics.com, and also the Rotary for their technical expertise and assistance getting us up to speed on this new way of doing business. Have a good day, everybody. Thank you so much.
Thank you.